Hi, my name is Professor Kuntal Patel. I'm a Consultant Orthopaedic Surgeon in the North Western UK, working in Lancaster, Blackpool, and Preston and Blackburn. Today, I would like to talk to you about the different types of hip replacement. So, first of all, let's discuss what is a total hip replacement. Total hip replacement is essentially an artificial joint that replaces a native hip joint. And this is commonly done for patients who have arthritis, osteoarthritis being the most common. It can be done for other conditions like inflammatory arthritis, like rheumatoid arthritis, following previous fracture, etc. And there are some rare conditions when a hip replacement is done. So essentially, a hip replacement is one of the commonest procedures done in the UK and around the world, and one of the most successful surgery that has ever been discovered in human history. The modern day hip replacement started in the early 1960s, and over the years it has evolved significantly. Well, let's focus on the different types of hip replacement. So hip replacement can be divided into two different types in terms of how it's fixed to your native hip joint, and then broadly speaking, the other way to classify it is what bearing materials are used for a hip replacement. So in terms of how it's fixed, it can be broadly categorized in two categories. One is it's uncemented or it is cemented. So essentially, the difference is there's a special cement called a bone cement that is used to fix the components of the hip joint, which is either the socket, which is a cup, or the stem, which goes inside your femur. Either of them is fixed with cement, or both of them are fixed with cement. And the other category is it is uncemented. Uncemented as in it's not glued onto the bone, and then we're relying on the bone to grow onto these components. And then the second way to look at the type of hip replacement is the bearing material we use, which can be different types of metal, special types of plastic, or use of ceramics. Well, why is this important to think about different types of hip replacement? Because in simple terms, one size does not fit all. So therefore, different patients have different expectations. You have different lifestyles, and you want to get different things out of your new hip. And based on these requirements, it's best to customize a type of hip replacement for you. This will largely depend on the bone stock or the bone quality you have, your age, physiological needs, any sporting needs. And based on these, in my practice, I choose what I feel would be the best type of hip replacement for you. So, for example, if somebody is quite old and frail and the bone quality may not be great, in very simply put, a cemented hip replacement will work very well for you because we are relying on the bone cement to fix those components onto your bone. Whereas if somebody's bone stock is very good and you're quite young, fit physiologically, then an uncemented hip replacement may work well for you. And in terms of the types of bearing materials, I often use ceramic hip replacement for patients who are higher demand with a special plastic bearing to fit onto the ceramic head. Let's talk about any couple of interesting facts about hip replacement and the types of hip replacement. Did you know what are the commonest signs of hip arthritis? Well, obviously most people think that you have to wait till you really have severe pain in the hip, you have a lot of stiffness in the joint, and that is correct. But the commonest signs to look out for hip is if you struggle to bend and clip your toenails, you start to struggle to put your own shoes and socks on, that could be the start of hip arthritis, and it's best to get some advice and assessment and see if any minor procedures can be carried out. Lifestyle advice can be carried out before you even need things like hip replacement. And then the second question I often get asked by my patients is, are there any advances in hip replacements? Have things evolved? And clearly the answer is yes. And obviously, without getting into too much detail, the advances have been in terms of the type of hip replacements. The bearing materials that we use in hip have been advanced significantly over the last 50 to 60 years. The pain relief that you can have after the surgery has been quite sophisticated. These days, we expect patients to be up and about on the same day after the joint replacement. You're only in hospital often one night or even less and you can be mobile and get back to your home as quickly as possible. So in summary, there are various different types of hip replacements, and it's best that it can be customized for you as an individual, and please discuss with your specialist when you proceed with the hip replacement. Thank you.